This epidemic of gun violence is a uniquely American problem.
Enough debates, enough mere platitudes about thoughts and prayers for the victims.
They can take those euphemisms and stuff them.
Democrats wasting no time pushing gun control after the Las Vegas shooting, and joining them now, the American Medical Association, tweeting this: gun violence is a public health crisis, evident by the senseless loss of life and injury in Las Vegas. Thank you, brave first responders. But what do you think? Does gun violence really qualify as a public health crisis? Well, here to discuss this is Dr. Nicole Saphier. Hey, Dr. Saphier, thanks for being here. What do you think?
Well, I want to reiterate what they said. Thank you to our first responders, all of the healthcare personnel who have helped everyone. That is an amazing job. Calling something a public health crisis, it's really a matter of perspective. But with that would come increased funding for research and potentially a lot more mandates when you call something a crisis. Usually when you talk about a public health crisis, that means more like natural disasters, our hurricanes, our earthquakes, and other infectious diseases that we're seeing. And so that's really what I think is more appropriately called a public health crisis, not necessarily gun violence, although we do have a gun violence problem here. But is it really a public health crisis? I'm not sure about.
Why wouldn't they call it a security crisis?
In my opinion, it's not a public health crisis. It is a national security issue. Now, I will say, though, the majority of our gun violence deaths are due to suicide. So maybe we have a largely untreated mental health crisis. That is true, but that isn't necessarily synonymous with just gun violence. Like, we do have mental health issues. And in a world right now where we have record-breaking numbers of STDs, we have measles coming back, we have a lot of public health concerns, that is where I think our attention needs to be. Our public health funds needs to be attentive towards that.
So you think the Democrats are doing this and the Medical Association are doing this just for funding, to get more money?
Well, I'm not going to say why they're doing it, but I do think when you call something using that rhetoric a crisis, your next step is going to be requesting funding for it, for research, how to prevent it. But we need to focus on securing our borders, securing our Americans, and making sure everyone is safe.
Okay, what are legitimate health issues that you think need the most funding? You mentioned a few.
Well, right now, what we're seeing from the hurricanes, we need to make sure that, those are huge public health issues right now. You have diseases, you have a lot of infections, those really require our help right now, our funding. The people in Las Vegas, so we have a lot of healthcare personnel who need to be helping there.
Not to mention breast cancer and heart disease and diabetes that affect so many people in our country.
Right, exactly.
Okay, thank you so much, Dr. Saphier.